Welcome back. In this video, we are going to discuss about crush injury. The objectives of this session are crush syndrome, causes and treatment. Crush injury occurs when a part of a body is squeezed or compressed between two high forces or the pressure systems. So you can see here this part of a body which is squeezed between the two forces, the one which is exerted by the ground and the other one which is exerted by this object. Then it is crushing this part of the body. The crush injury is occurring when it is squeezed between the two pressure systems or the two forces. So, this results in the extensive lacerations, bruising, compartment syndrome, crush syndrome. If the crush injury is of a severe type, it can lead to the fracture of the bones and there is severe bleeding or hemorrhage which is occurring, and also the extensive tissue destruction and devitalization. The renal failure, hypovolemic shock, and sepsis are the dreaded problems in crush injuries. In the upcoming slide, you'll know how the renal failure occurs in the crush injury. Hypovolemic shock, it is because the blood vessels are damaged and then it can lead to the oozing of the blood. There is hemorrhage and edema, hypovolemic shock. And the sepsis. The sepsis occurs when the chemicals, that is the myoglobulin, will be released into the bloodstream, and to fight the infection it triggers an inflammation throughout the body which is nothing but the sepsis. Let us see how the renal failure occurs in the crush syndrome. Due to the crushing of the muscles, which is causing the extravasation of the blood and release of myoglobulin into circulation, which is leading to acute tubular necrosis and acute renal failure. So guys, you can see in the picture here, this is the muscle. A damage or the crushing of these muscle will result in the release of a toxic protein called as myoglobulin. This myoglobulin acts on the blood vessels and then enters into the kidney. On the blood vessels, it causes the capillary damage, edema, hypovolemia, and then when it passes through the blood vessels and reaches the kidneys, it causes a acute tubular necrosis. The renal tubular cells will be injured and this results in acute renal failure. How does it occur? Because the myoglobulins will collect in the kidneys faster than they are eliminated. This myoglobulin starts accumulating in the kidney. This is the toxic protein. Once they are accumulated, it results in the necrosis of the tubular cells of the nephrons and renal failure. What are the causes? We have earthquake, mining and industrial accidents resulting in crush injury. You can see the person here being crushed in the mining and industrial accidents, air crash accidents, or the tourniquet which is being tied. The other causes, initially what happens, the tension will be increased in the muscle, the muscle compartment. Commonly the crush injuries will be in the lower limbs, which itself will impede the circulation and increases the ischemic damage. So you can see here what happens to the muscle. This muscle, the tension in the muscle is increasing. As the tension in the muscle compartment will increase, it will impede the circulation. It is interfering with the circulation, so the blood supply is not sufficient, reduced blood supply, leading to the ischemic damage of that particular part. In 3 days, the action on the urine starts because now the myoglobin have started accumulating in the kidneys. So the urine will become discolored and it will be scanty. Patient will become restless, apathy and delirious with the onset of uremia. Crush syndrome is often a life-threatening injury and it is much worsened than the initial look. So once you just have the initial look, it doesn't seem like this injury can cause such severe problems. But then it can cause the acute renal failure, hypovolemic shock, and the person can land up in death. So you can see here, muscle tension will be there, ischemic damage to the muscles. Then you have to write the changes in the urine becoming discolored, scanty, and Physically, what happens to the patient? He becomes restless, apathetic, delirious state with the onset of uremia. Effects of the crush syndrome, we have a renal failure because of the myoglobin toxin, and then we have toxemia. So here they're talking about toxemia and septicemia, disability with the extensive tissue loss, and gas gangrene. So guys, you can see here we saw that septicemia occurs when this myoglobin is released, and throughout the body the inflammatory reaction will be there. And then we have this toxemia. Why does toxemia occurs? It is because of the rhabdomyolysis, which is nothing but the crush syndrome, which is causing the damage to the muscles. Rhabdomyolysis. This muscle injury will cause the large quantities of potassium, phosphate and myoglobin, creatine kinase and the urate to leak into the circulation. When all these toxic substances like myoglobin, urate, creatine kinase, potassium, phosphates are secreted or released into the blood, it will result in toxemia. And we have the gas gangrene. Gangrene is the death of the muscle or the necrosis of the tissues, which occurs first. There is ischemic damage. Once the blood supply is altered, there is reduced blood supply, ischemia, prolonged ischemia resulting in the gas gangrene. Treatment. Tension in the muscle compartment will first be relieved by placing the multiple parallel deep incisions in the limb. This will prevent the further damage. This procedure is known as fasciotomy. So guys, you can see whether it is a hand or the limb. So there is a lot of tension being created in the compartment syndrome. To release this tension, this lateral incisions will be made. Multiple parallel deep incisions are made to prevent the further damage to the muscle. This procedure of giving the lateral incisions, deep incisions, is known as fasciotomy. Mannitol is given to improve the urine output, and it improves the renal function in the patient. Alkalization of the urine is done by giving the sodium citrate or sodium bicarbonate. Urinary pH should be above 6.5 until the urine does not show any myoglobin. So the urine analysis should indicate that there is no more myoglobin present and the pH should be above 6.5. Mannitol alkaline diuresis should be 8 liters per day. Tension, so we are done with this. Initial aggressive volume load is done by using the saline. About 1 to 1.5 liters per hour is ideal in the patient suffering with crush syndrome. Hemodialysis is done sometimes as a life-saving procedure if there is renal failure. The other measures will include the catheterization, oxygen therapy, appropriate antibiotics if there is a toxemia or sepsis or inflammation of the body, blood transfusion, correction of the severe hyperkalemia. Thank you. With this, we come to an end of crush injury. If you like my video, hit the like button and subscribe.